My name's Asma and I'm 35 years old and I'm from the UK. I found the PT Foundation through a friend who works here with Red Cross, and she recommended PT, and I looked at their website and I thought this is the kind of work I'm doing in the UK, so I sent them my CV, my resume. With PT Foundation, I'm working with the HIV testing side of things, so VCT as it's known, and also I'm doing research, so research around marginalised communities, so MSM communities, men who have sex with men, and we're looking to start a project with UNICEF around most at-risk adolescents, so young people, and their sexual health and HIV and reproductive health needs. It's quite varied because I'm doing. So when I started, I was sharpening pencils, but I said, okay, I don't mean to sound very big-headed, but I've been nursing for a long time, so my skills are HIV, sexual health. Can I get involved in that? And then very quickly, within a week or so, I was offered research work because I did a master's in public health. And so my background is research as well. So it may involve attending meetings with our partner organisations. So for example, last week we had a meeting with the Ministry of Women regarding our young people project that we want to do with the UNICEF, because we need to try and get the consent from a legal point of view. And then today I was taking notes for a new programme that started, so it varies quite a bit. And then on Friday I may be HIV testing in the clinic, so seeing clients. At the moment, I think in my last meeting we discussed 30 hours a week. But before that, before when we were getting our proposals ready for ethics submission, probably 40 hours, more than 40 hours. I was working in my own time as well. It was just because I'm a nurse from the UK, I had a clinic, so we had set times, but working in my own time, I could just work all hours, so I'd be at home and I'd just turn on my computer and start working again. But now I have a pattern of when I want to work. I've kind of got more into the role of working independently and doing. Because the work that PT do is around HIV and sexual health, so promoting safer sex, working with marginalised communities, so the men who have sex with men population, sex workers, transgender, and those communities generally tend to face a lot of stigma and negative feelings from, you could say, the rest of society, but particularly so here in Malaysia, where the legal system doesn't recognise or men who have sex with men communities, and then also transgender communities are not recognised legally, so they end up being on the streets. So we're here to support people and to try and change. Well, for me, it's a slow change, but eventually, if you keep working together, then it'll lead to a change. Although we're not actively trying to challenge the system, hopefully one day it'll change when there's more recognition. I'm Asma from the UK and I'm giving my gap.